Hello and welcome to Health Professional Radio. I'm your host, Neil Howard. Thank you for joining us. Our guest today is Dr. Corey Hunter. He's an interventional pain specialist, also founder of the Ainsworth Institute of Pain Management. And he's joining us on the program today to talk about why he started the institute and alternative treatment options for opioids. Thanks for joining us on the program today, Dr. Hunter. How are you?
Good. Thank you so much for having me.
Now, I did mention to our listeners that you're an interventional pain specialist, also the founder of the Ainsworth Institute of Pain Management. A bit of background. Sure.
I'm actually, I do a little bit of teaching here too. I'm an assistant clinical professor at Mount Sinai, and I work with residents here. But my general background is years ago, before I went to medical school, I did a lot of research on stem cell therapy, using it for Parkinson's, paralysis, and for pain before I even know I wanted to go into it. And then pretty much, I guess, like halfway through my residency, I basically decided that I actually wanted to go into pain management, just all the research I did. And, I wanted to, my mother was a prescription drug addict. And so I wanted to kind of, I liked the field. I'd done so much research on it. And just on a more personal note, I wanted to have an impact in other people's lives and try to prevent what had happened to my mother. And it all seemed to fit in place. And then here I am now.
Is it true, or is it a myth that many or most of the people that are addicted to opioids start because of an injury, a surgery, something like that, and next thing you know, in a couple weeks, a couple months, they're totally addicted and off from there?
It's not a myth at all. I mean, you really hit the nail on the head there. It's really quite common. It can start off as a toothache, a simple sucker injury, a broken bone, ingrown toenail. I mean, it's not the case in everybody, but I mean, what you described is really commonplace. In my mother's case, she just started off with having migraine headaches in the 80s. And doctors are very comfortable with opioids. We've been comfortable with opioids for a long time. And in medical school, there's no training in it. We'll spend a lot of time learning about heart attacks and like what to do and, how to treat a broken bone or a stroke. But when it comes to opioids, it's literally like a one-day lecture, and it barely goes over any of the dangers and the concept of addiction or overdose or misuse. And that's basically our training. And then we all go into our respective specialties having only had that one lecture. And what happens is ER doctors or primary care doctors, they don't know any different. And they start the patients on it, and they come back and they need another refill and another month, and 1 month, 2 months, 3 months becomes 2-3 years. And next thing you know, the patient started off with just a migraine headache or just a broken bone and just a minor backache, and now they're addicted.
Now, with all of that going on, this exponential growth, how many people are actually suffering from chronic pain, and how many of those people are dealing with the opioid epidemic?
So that's a great question. It's really, I think people, when they hear the numbers, they're always surprised. So right now, currently in the United States, there's about 100 million Americans that are suffering from chronic pain. And the direct and indirect costs of pain and chronic pain in this country are $635 billion per year. And now when you take that, you have all those people, and then now you take everything that we know that we're mismanaging and not properly managing pain. Opioids, this was just the perfect storm. And then you take things like the introduction of OxyContin, and more opioids coming to the market. So now, currently, opioids have now surpassed motor vehicle accidents as a leading cause of death in the United States. So it's not slowing down. In the last year alone, deaths from fentanyl and synthetic opioids went up 72%. So this is, and heroin made a huge comeback because of opioids. So now, between 2010 and 2015, the deaths from heroin use increased 328%. And this is all because they start off on the opioids. They start off in the oxycodone. They're getting it from their doctor, and then they go to get it on the street. And it costs about anywhere from $1 to $5 per milligram. And eventually it becomes too expensive to take oxycodone. And then they go to heroin. And eventually one thing leads to another, and then they die of an overdose from heroin. So it's, as long as pain is still a problem and as long as opioids are still accessible, these two have a perfect match, and they're going to keep going.
Aside from the pain, I mean, obviously the pain is a challenge, and it's chronic pain. It's not like, the inflammation will go away on Thursday and I'll be okay by the weekend. This is ongoing chronic pain. Aside from that, and aside from the very real danger of becoming addicted, what are some of the other unique challenges that a person facing chronic pain is dealing with?
In some of the more, interesting cases with chronic pain, it's something that the people around them can't see or understand. So it's really, I think it's a challenge for people to kind of get their loved ones or their friends to kind of, buy into what's going on. They think that maybe they're just being dramatic. So one of the things I treat a lot is like facial pain and pelvic pain. And it's not something you can see or feel. And family members just think that they're crazy. They think, look, there's nothing wrong with you. Why can't you just get over it? So they're dealing with this intense pain. They can't do the things in their life that they normally want to do. And then now their family is kind of shunning them, and they don't even get support. So that's probably the most challenging thing, is the psychosocial aspect of it. They can't work. They can't play with their kids. Their loved ones think they're crazy. And on top of that, they're just in excruciating pain.
You say family members and friends. All politicians are someone's family, someone's friend. What about legislation? I mean, do some of these more personal aspects seem to creep in when it comes to legislation directed toward the opioid epidemic? We
wish it would. Right now the Surgeon General is a pain doctor, which is great. One of the heads of Human Health and Services is a former graduate of where I did my fellowship at Cornell, Vinal Singh. And we're kind of all hoping that this is stuff that's going to help us, having people that understand our specialty at the top. But what's happening is that there's pharmaceutical companies have a lot of lobbying power and doctors don't. So as much as we're, I'm the head of a couple of major medical societies on the board of directors, and, we get asked to help chime in on things for CMS, which is the Center for Medicare and Medicaid Services. And they ask for our opinions and we write letters. But, we're a small voice compared to, lobbying firms and things like that. So they listen to some of the things that we're doing, trying to limit the amount of opioids that a person can get from a primary care doctor. And we're trying to really create this legislation to limit, how much a primary care or a dentist can dispense. But, these are things that are really hard, because then there's a lot of other people that say, well, we can't minimize pain. Like, we need to make sure that patients have access to opioids. And, that's really the problem, is that we're not trying to decrease people's access to opioids. We just want to make sure that if they do really need it, it's being evaluated and dispensed by the proper person. No one would ever let me dispense a chemotherapy for a cancer agent, for a person who has pancreatic cancer. So why is it any different to let someone whose only training is treating root canals write a prescription for Percocet? So we just want it to kind of like apples to be apples here, just for what we're doing in other specialties in medicine, for the same to be done here.
What are some of the options, to opioid use? Non-opioid pain relief? Is it all medicine? Is it physical therapy? Is it shock waves? What are some of the alternatives to treat some of this chronic pain?
So I'm really glad you asked that. So this is, something that, people, when they hear I'm a pain management doctor, the first thing they think of is, what you're kind of alluding to, is the medications. And what we specialize as pain management doctors is we specialize in alternatives to medications, and more specifically alternatives to surgery. So we usually don't start out in pain management until a person is exhausted, like 6 to 8, sometimes 12 weeks of conservative therapy, which is, physical therapy, chiropractic, acupuncture, anti-inflammatories, things of that nature. We let the basic things go to work first. And the statistics show that if a person does like a multidisciplinary conservative care, that over 90% of the time, the person's pain will get better. It's when the patients don't respond to the conservative therapy is when we come in. So we'll try things like nerve blocks, epidural injections, something called radiofrequency ablation, where we can apply radio waves to certain nerves and basically kind of prevent their ability to transmit chronic pain. When patients get into the chronic pain realm, it becomes really becomes a lot more challenging, because the nervous system becomes hardwired to want to transmit pain. So the injury is probably long healed at this point, but it's still transmitting pain. One of the things that we do in pain management for these patients is something called spinal cord stimulation. And this is something that's really just been a huge growing segment in the field of pain management, and it's just kind of seemed like a second renaissance over the last couple years. This one has been around since like 1967, wow. But people have only really heard about it in the last, say, 10 years. And it's just been, like I said, it's an explosion of innovation. But the really short way of describing it is everybody's familiar with a pacemaker for the heart. Mm-hmm. This is very similar to that, instead of us trying to manipulate the electrical signal of, say, the heart, we're doing it for the spine and for the nervous system. And we can actually really effectively treat and reverse some types of chronic pain by sending the right signal to the right part of the nervous system. And we can get these patients the care that they need. And in some studies, we've actually shown that we can get patients off opioids by doing it. So it's really a great therapy.
Where can our listeners go online and get some more information, much more information about the Ainsworth Institute of Pain Management and some of these alternatives to opioids that we've been discussing this morning?
So I have a really robust website where I actually just kind of list all the conditions that are out there, all the treatments. It's ainsworthinstitute.com. That's AINSWORTH Institute, all one word, .com. And I have a listing of just pretty much just about every major condition out there, every major treatment that you can think of. And then if people are particularly interested in things like the spinal cord stimulation and to that nature, you can go to a website called aboutyourpain.com. It's sponsored by a company called Abbott, who actually happens to manufacture a few of these stimulator devices, and ones that I think are very, very effective. And you can read more about the therapies and find a doctor in your area that's trained and prescribes them, and see if it's right for you.
Dr. Hunter, thank you so much for joining us on the program today. It's been a pleasure. Hoping we'll talk again.
Thank you so much, sir. Thank you very much.
You've been listening to Health Professional Radio. I'm your host, Neil Howard. Transcripts and audio of this program are available at hpr.fm and healthprofessionalradio.com.au. You can also subscribe to this podcast on iTunes, listen in, and download at SoundCloud. And be sure and visit our affiliates page at hpr.fm and healthprofessionalradio.com.au.
Thank you for listening to Health Professional Radio. We're very proud to be an independent broadcaster providing our content free of charge to you, the listener. One of the ways that we're able to remain free and independent is by having people like you become patrons. You can support Health Professional Radio simply by visiting hpr.fm and clicking the button that says Become a Patron. Your patronage of even just $1 a month lets us know that you're there, which in turn makes us more valuable to advertisers. And, of course, if you're able to afford more, then we would certainly appreciate the support. My name is Toby Longhurst from Health Professional Radio. Please visit hpr.fm, click the Become a Patron button, and support us if you can.